Good morning. September is National Suicide Prevention Awareness Month, a time to remember those we have lost while also bringing mental health to the forefront, reducing stigma, normalizing care, and hopefully saving some lives. So, with nearly 1 in 5 American adults having a diagnosable mental health condition in a given year, and 41% of all US adults experiencing at least one adverse mental health symptom during the pandemic, it's not shocking that death by suicide is the second leading cause of death for those ages 20 to 34, and the fourth leading cause of death for those ages 35 through 44, according to the American Foundation for Suicide Prevention. So, committed to talking about and tackling this harrowing crisis, evolvedMD's Suicide Prevention Awareness Month campaign has been productive and impactful, with plenty of great content and support from our many partners, including Premier Family Medical in Utah. So today I'm joined by Dr. Kropp, a physician at Premier Family Medical, to have a conversation about suicide prevention in primary care and how integration has helped and been impactful at their clinic. So with that, Dr. Kropp, welcome.
Thank you. It's good to be here.
First question for you is, and maybe to provide some context and background, can you tell us why it was important for Premier Family Medical to partner with evolvedMD to integrate care?
Yes, great question. It's been important for us. The most common question we have is, where do I go? How much does it cost? And people having that are either depressed or anxious, those can be big hurdles for them to overcome. And so being able to simply say, where do you go? Right here. Who is it? I know them. They're great. What does it cost? Same copay as come to see me. So all those barriers, we just blew a bunch of barriers out of the water for our patients to make it easy for them to come see mental health professionals.
I love the way you put that. Also, that's probably like the best way I've heard it put, especially from a physician, which is, this collaboration and partnership really does eliminate barriers. There's so many reasons why folks would not be able to access services, but adding how much does it cost, adding where do I go, just location, dollars, those things are all brought in-house and makes it very easy for those who want care to receive care. So talk to us, patients get the care. How have you seen mental health impact physical health at your clinic?
Well, we see it all the time. It's the mind, body, spirit approach, right? So if your mind and your spirit aren't right, it affects your body. It affects your eating habits. It affects your activity. It affects your performance at work or at school or with your friends' social life. I mean, it's the core center, right? And so we got to make sure that your mind and your spirit are taken care of. And if we don't, then we're not treating the whole person. And that's what medicine's really trying to do, is treat that whole person.
Treat the whole person. That's great. And when looking at treating the whole person, do you mind telling a story, or do you have a story of what you've seen from this partnership in action, like a story from a patient in the clinic?
Yeah. Yeah. I've had a suicidal patient multiple times in my clinic that's come. They often go see their physician before attempting suicide within weeks to a month. And so in the past, I've had to call other places and rely on them driving over or different things like that, where I've been able to have a warm handoff, knock on our mental health professional's door and say, hey, I need you. And they've been great to come in, and right there we got a nice warm handoff. We've got continuity of care, and it's been, I think our patients really appreciate it, because again, we talk about those extra steps, right? When we're feeling great, going to another place, not a problem. When you're thinking about suicide, I mean, that's a huge step to go to yet another place, right? And so being able just to have right there, here you go, here's a mental health professional to keep that care going.
A question that we didn't discuss before, but I know you'll be great at answering this, would be how have you seen kind of the reduction in stigma? I know that depending on generation or background or whatever it might be, seeking mental health services can be seen as taboo or seen as someone being weak. And a lot of times people just can't get over the hurdle because of that stigma. But talk to me about what you've seen in your clinic and anything that you are encouraged by.
Right. I think we are seeing more awareness, and through different campaigns like you guys are doing is helpful. Uh, I saw a lot of this when I was in the military. People worried about, hey, can I bring this up? Will this affect my career? And having a place that's, again, they come right to our family practice clinic, so they don't have to worry if they are worried about the stigma. Well, now we've kind of removed that, oh, my friend might see me walking into a psychiatrist's office or psychologist's office. Well, just walk into family practice. So as we keep battling to remove the stigma to normalize that, hey, in your lifetime, you're probably going to have some anxiety, some depression, or some other mental health issues. And that's perfectly normal and natural part of life. And coming to your family physician or your primary care physician and talking with them and having the resources right in that same room, we just make it easy for them. So if they're worried about stigma, well, fine, they don't have to see it. No one needs to know, right? You have that privacy. I mean, I hope that we can get rid of that stigma, as we go through these awareness campaigns to make it easy for people, right? That's our goal, right? Make it easy to get the healthcare you need.
Yeah, and unfortunately, we jumped right into this, and I would love for you to tell the listeners a little bit about your background because it's very unique.
So my background is I went to an osteopathic school in Kirksville, Missouri. When I got accepted to med school, I saw the bill, so I signed up for the Air Force. I served in Iraq for a deployment. I also was an attending at a family medicine residency, and we called it BHOPs, or Integrated Behavioral Health Operations, in our clinics in the military, because the military saw the need from all the PTSD and the trauma you go through with 2 wars going on. And so in the military we had it, and when we didn't have it here, I was sad, and then we were able to get it. And so that was that's been great again to kind of stay to that whole person approach, right? Mind, body, spirit, because we need all of those.
It's you saw it firsthand, the power of behavioral health integration, and glad that you get to have it at your clinic. Was there anything that you would like to pull out from your experience in the military as it relates to mental health? I'm just curious about. I'm sure there's a lot of things that were there, but anything that stood out to you serving or with the people you served?
Just that it wasn't only the active duty professionals, right? Just everyday life is stressful. I mean, you talk about things of losing a job, losing a loved one, going through a divorce, trying to get into different programs of schools, dealing with mean people. Sometimes people are rude, right? Just those everyday stresses, yeah, they affect you. So it's not just big things that cause problems, right? It can be accumulation of little things that finally you're like, it's gotten to me. I need to do something about it. I need to change my, how I think about that, how I react to that. Do some cognitive behavioral therapy, right? To reset my brain, just like I'd reset my muscles. If I pull the muscle, I go to a physical therapist and do my stretches and my exercises. And we got to do that for our mental health, right? There's exercises and there's training and things we can do for our mental health to strengthen it.
I appreciate how you put that. I appreciate how, and you've seen it firsthand, just the power of how mental health impacts everything else. And it's really nice to hear a physician talk about it this way because all too often those things are so siloed and separate. But understanding that those two things working together is really how a person can thrive. And in that same vein, and bringing awareness to this month, what do you wish other primary care providers knew about suicide and suicidal ideation?
You can't always tell what someone's going through. I think one of the big ones that shook me was when Robin Williams, right? He
Right.
looked like the happiest guy
The
around.
happiest, most jovial guy ever.
He made me so happy. I loved watching him, right? I was a big fan, and I was shocked when he committed suicide. And so looking at someone, you just can't tell. So as providers, making sure in our visits that we ask if how they're feeling, and ask those simple PHQ2, right? You can do 2 questions and just see if anything's there. So I guess I'd say just ask about it, ask how they're doing, and check on them, because when looking at them, you can't tell by looking at someone if they're having suicidal thoughts.
And that's great. And I love how you mentioned the screening. One of the things that we really, really are committed to at evolvedMD and trying to work with a lot of our partners is this idea of universal screening. So every patient, every time. And there's a reason for that because that's how you catch if someone's going through it and then are able to assess what needs to be done to kind of get them happier and healthier. So for anyone who has a mental health issue or they're just kind of feeling down, and like how you talked about how it doesn't necessarily have to manifest in something big. It just could be a lot of small things. So if someone's sitting in your waiting room at Premiere, what would you tell them? Like, what would you tell them to do?
Bring it up. Say something. We can't help problems we don't know about, right? And hopefully we have screening things in place where we try and catch it, but we're not perfect. So we may be busy and you may be coming in for a sore throat and your real problem is more of your mental health. And so we hope you bring it up. You tell us. If you tell us, we can help. We try and catch it and we try and do the screenings, but no one's perfect. So just bring it up. Tell us how you're doing.
This is great. This short conversation, and I have the great privilege of overseeing all the marketing at evolvedMD. You've given me so many good nuggets that we're definitely gonna use in language and messaging. Is there anything, just a final, right off the top of your head, or anything else that you want to kind of convey to the audience that's listening? You did a great job of really talking about how we need to normalize this, how mental health disorders and just having mental health symptoms are so normal and so commonplace. So thank you for that. But anything else that you wanted to add to this conversation?
I think in awareness, don't be afraid to talk about it. Talk about it in your family. Let people know how you're doing. So many times I ask people, is anyone else in your family struggling? And I know the answer because I see their family members, but they don't know.
Right.
And so I said, well, maybe talk to your family members and see what they've done to overcome and to get back to their baseline or get into remission for some of their mental health issues. And so I'm just surprised how many people, again, talking about that stigma, even with their own families, we don't talk about it. And you got to be able to talk about it with your loved ones. Start there.
Thank you for that. No, this was a great conversation. I always like to keep it short and sweet. If you are a patient with Premier Family Medical, please, as they said, just bring it up. Or if you're a patient anywhere in the country and you want these impactful services at your place, please contact us at evolvedmd.com. And till next time, thank you so much.
Thanks. It's nice talking with you.